What a gorgeous young man. If you've been affected by any of the issues raised in that film, you can contact our action line, bbc.co.uk/action line. Let's talk now to Anne Longfield, the Children's Commissioner for England, also John Simmonds, who's a qualified social worker and a director at the fostering and adoption agency Coram BAAF, and Sylvia Schroer from Adopters Together. That's a group of adopted parents campaigning for change. Anne Longfield, tell us about the scale of the problem when it comes to mental health issues of looked after children.
Well, we've got about 70,000 children in the care system at any time, and actually the majority of those, at least 60%, have mental health issues. Unsurprisingly, they've often had some of the greatest traumas any of us could think of before they actually enter care. And whilst there are assessments around health and well-being, so many children not only say they struggle to get help in terms of mental health support, but also come out of it saying, look, what we want is kindness, we want love, we want people to believe in us. So what I am saying, what I'd like to see is a much greater emphasis on helping children recover. We've had a fantastic example there of Callum, really genuine, fantastic young man with his whole life ahead of him. That can be for every child in care, but they need help to get there.
Some of the recommendations, or one of the recommendations from the report that is produced on this today, is this idea of a virtual mental health lead. So one single person with oversight for mental health in each area for every looked after child.
I think that'd be really positive, absolutely. More help and support for foster carers to deal with mental health issues and complex issues with children. This has come from the Department of Health and the Department of Education together, and it comes ahead of a green paper. So I think there's much in there that could be acted on.
John, hello.
Hello.
Specific challenges for social workers when it comes to looking after children in care and their mental health.
Yes. I mean, I think one of the things that stands out really, looked after children, we're talking about newborns and we're talking about 18-year-olds, so there's a very big span. One of the things that came through in Callum's discussion about his experiences, family life and relationships are absolutely core to who we are. And I suppose one of the big issues for me when we come to talk about mental health is that generally we're talking about relationships that have gone wrong, relationships which cause anxiety, relationship where there's abuse and neglect, and a family life that is on the edge. And for many children that come into care, it's a family life that's broken. It's absolutely right that we should focus on issues of emotional and behavioural and mental health. But I think that the thing that we can't ignore is that for all of us, our sense of belonging and our sense of stability and security comes from a loving family life. So where a family life has broken down, which is at the centre of what happens for children when they become looked after, the issue is how do we rebuild something, either in the child's original family or in foster care or in adoption, in whatever the legal order that frames that child's new experience. But it's family life and relationships that are at the centre of that. And I thought that came across so strongly in Callum's view about his fiancée and his baby. He was creating a family life for his child, and there couldn't be a more central issue for all looked after children about their experiences of family life and loving relationships.
Sylvia, what are the kind of issues that the parents in your group are facing when it comes to looking after children and mental health problems?
The biggest issue that we have, sadly, is blame. We parent in terms of the 70,000 children in the care system, what the Selwyn report, which was done in 2014, found was that adoptive parents parent the most severely traumatised and abused children. So we're at the very, very extreme end of the mental health problems. And we have a problem at the moment, which is that in the system, it's very child-focused, and when the attention is focused on the child, it's not on the family as a whole. We are, in effect, the intervention. We are the policy intervention. But what happens is that when we ask for help, intervention comes between us and our children. And that has to change, and blame has to go. So whilst this is a very positive move of the virtual mental health lead, we feel that it needs to go further, because that person could actually do harm if they did not have an awareness of adoption issues. And we are calling for an adoption guardian to be attached to every single adoptive child in the care system. who will go to meetings and who will support the family. Love, belonging and permanence.
Which sounds incredible.
Yeah.
And obviously I'm going to say it, but that will cost money. Let me tell you what the government says. Are you saying no, it won't cost any money?
No, it needn't cost very much money at all.
Okay, some money.
And also, the money is going to come from, the BBC did a survey recently where they found that of the 3,000 people that were that responded, a quarter of them said that their children were going to re-enter care. It's termed a disruption, which is a very misleading term. And that each of those children is likely to cost £1 million. Wow. So that's 750 million.
So it would be money
this is money saved. This is money saved.
Government spokesman, obviously we asked for an interview and didn't get one. We're putting a record £1.4 billion into children and young people's mental health, but there is more to be done, and we will now consider this report with a view to taking further action. This from Chris on Twitter: difficult to argue with the Children's Commissioner that there should be a presumption that children in care needing mental health support should receive it. Leighton says there is a huge deficit in the way we deal with young people's emotional issues. We penalise self-harm or disruptive behaviour, committing them to ad hoc counselling constantly, but there is no consistent good quality counselling, and so your idea would make a difference for many young people. I mean, do you worry about the fact that it would, you know, having this kind of virtual mental health SAR or whatever you want to call them in each area is going to come down to resources in the end?
Well, I mean, as you said, actually, it's investing now to save later, because, you know, if we can get children to the point where they're confident, they're actually able to either go back to their own family or actually move into their adult life confidently, because that's actually also the transition to adult is the point where a lot of children fall off in terms of mental health support, then it's going to be much easier on the public purse. So it's investing early to save later. But one of the big issues children tell me about is stability, is permanence, and is that feeling of belonging. So it has to be absolutely at the centre of the care experience.
Okay. Thank you all. Thank you very much for coming on the programme. Thank you. Thank you.